Hi, my name is Elliot Fishbein, owner and physical therapist at Connected Functional Manual Therapy, and welcome to this month's video blog. So this month, our topic is going to be inflammation. Last month, we talked about the different pillars of efficient function and how they can affect your ability to achieve wellness or effectiveness in your workout and your exercise program. And this month, we're going to talk about is inflammation and how that can also impact your general overall well-being, but also how well you're able to achieve goals with fitness and wellness. So the first question is, what is inflammation? Well, there are different reasons why you can have inflammation. What inflammation is essentially when there is a stress in the body. Your body will send more blood to that area, which will both be there to clean out byproducts or things that have been produced during cellular processes, but then also feed in more nutrients and things to help a healing process. Or if there's some sort of foreign invader, in the case of like an allergy or something of that nature, that you will actually then be sending things to attack that invader and kind of protect your body a little bit. So there are different types of inflammation. So obviously the inflammation, your typical inflammation, which is something that may occur when you're exercising, is that, what we talked about before, where you have blood that kind of rushes there, which is there to clean out the byproducts you make during the cellular processes, because it takes a lot of energy to kind of use your muscles and move things around. So you're constantly trying to clean out the byproducts and feed in new things so you can keep producing energy and keep using those muscles in that region. You also have inflammation that can be done when there is stress to the system, which can happen in a few ways. Certainly, if you have things that are rubbing that should not be rubbing. In the case of like arthritis, when a bone is hitting a bone, your body is going to recognize that as abnormal, and it's going to send inflammation because it's going to try to repair those bones that are hitting each other and causing some damage. Similar things can happen if you're having excessive stress on a tendon, a ligament. So that's a case where you'll have some degree of pathological inflammation. And then also you'll have times when you have inflammation because of a foreign invader, which is the case of an allergen. Sometimes either you have something that touches your body or you ingest that is an allergy, and your body will send blood to that area to try to fend off the invader. And that's usually good in the case of certain things that shouldn't be entering your body, but oftentimes can backfire if you have certain food allergies or food sensitivities. So there are different types of different reasons you can have these things. So obviously there's environmental stress. So if you are in an environment where, let's say, you're around cigarette smoke all the time, that is something your body will respond to with inflammation because it's a foreign invader. Similar thing to if you have a sensitivity to certain smells, things like that, where you feel like you get allergies, you have a degree of inflammation. It's just in your sinuses where those scents and things are going. So that's a different type. And then there's the type we talked about where when you're exercising, you have blood rushing to kind of help heal those different structures. Obviously, when there is a major injury, if you've ever sprained an ankle, your ankle suddenly blows up like a balloon. That's a case where you've had a large injury, so there's so much inflammation that goes to that area. It's more than you'll typically get because your body is trying to heal quicker because you had a big injury. But the issue is that you can't get it out as quick as you can get it in, so it gets really swollen. And then when it gets swollen, it also blocks the channels that get the fluid out. So suddenly you get this big balloon-like area and you can't get the fluid out, and actually can cause congestion and actually reduce the amount of healing you can get done. So oftentimes, even with an acute injury, you're trying to get that inflammation down. Which brings us to, what are the types of things you deal with fitness and wellness? Because we're not going to touch on major injuries for now with inflammation, but how does it affect you more in the everyday? Well, certainly if you are exercising, in terms of how inflammation will affect you, it'll be, well, how quickly do you recover? How quickly after an exercise can your body get those metabolites out, those waste products out, and get the new stuff in so you can build muscle, maintain healthy joints, and feel better? And like, how quickly can you then go and stress that area again? Meaning, if I work out today, am I really sore and stiff for 3 days and it feels like I don't want to use those muscles, or I feel pretty good and I can go right back to it? And oftentimes that takes a degree of repetition to both build your body's tolerance to it and also to build the strength. So when you're looking at recovery, oftentimes you're thinking about things like, well, how can I increase the ability of my body to efficiently get fluid in and out? So ways you can do that, sometimes with foam rolling or release work. You'll open up fascial channels, which creates a little more space, so some of that fluid can get in and out to help you recover quicker. If you're doing more intensive athletics, then icing, or being in an ice bath or something like that. But again, that's mostly for people who really need to ice. It's because you're producing almost too much inflammation. That means people who are doing really high contact sports, really physical things where you're stressing your body a little bit more than a normal workout. And so then also things like compression, which you can use, like compression stockings, which some people are using now for recovery, which again, all that does is it serves the same purpose as actually, when you're doing a foam rolling, you're trying to open space, which helps to let things flow out. When you're adding compression, you're not opening space, but what you're doing is you're actually trying to push more of that fluid away from that area rather than letting it settle there like we talked about with the ankle. So it pushes it out, which then allows, again, your body to have less congestion in there, which allows you to heal for the long term. But then there's also people who have more chronic inflammation, which is not a response to a more immediate trauma, but it's something that happens oftentimes because of either an autoimmune disorder or because of some systemic sensitivity. And so the most common thing you're going to run into with chronic inflammation, aside from medical conditions that may cause it, are food sensitivities, food allergies. So oftentimes, your body may have a predisposition towards this for reasons that aren't always well understood. But again, we'll touch on the things that may happen, which includes food sensitivity. So these are times where you actually are ingesting food and your body recognizes that food as an invader, and so it starts attacking it. And as the nutrients and everything go into your system and stuff, that inflammation can actually leak into your system, and then suddenly you feel chronically either stiff, you may get bloated after you eat things, you may have mental fog and fatigue, and you just generally don't feel as good. So when if you're dealing with more acute inflammation, we talked about doing things to help push the swelling out. With more chronic stuff, you're thinking about actually your inner physiology. You're trying to create something that will decrease that systemic inflammation. So ways you can do that, well, obviously figuring out what foods you may be sensitive to. I may touch on this in a different lecture, but today I'm just going to mention them real quick. But there are a lot of different food sensitivities that have arisen in the last multiple decades. The most common I see clinically are people who are sensitive to gluten, people who are sensitive to dairy, and people who are sensitive to sugar. Oftentimes you don't realize that you are very sensitive. You just know that you ache or feel sore, or you get really sore after a workout, and you don't recognize that you have a very subtle sensitivity. And when you stop ingesting as many of those foods, you start noticing a difference. So oftentimes you'll work with patients to try to have them do elimination diets, meaning eliminating those things for a period of time and seeing what the response is. If it goes, to more specific dietary needs or people who have medical conditions, I'm usually referring them off to physicians or nutritionists. But for things like elimination of food sensitivities, that's something you will do. But again, usually you're looking at gluten, dairy, and sugar as the three biggest triggers. You also have things like FODMAP, which works on an enzyme called fructan, which is also something that people are sensitive to. Nightshades, which include tomatoes, eggplants, things like that. And then occasionally artificial sweeteners for some people. So diet is a big thing in terms of figuring out, is that part of the reason I'm feeling really sore and achy all the time, or am I not recovering as quickly after a workout? Or do I just do something and then suddenly my knee swells up after every time I do it, or maybe I look down at my ankles and they're always swollen at the end of the day. Those can be various reasons why ways that affects you. Other things you can do supplementation-wise to try to decrease the inflammation in your system. There are things that have a positive effect in that regard. Obviously, if you're doing any of that, that's the sort of thing you would make sure you're consulting with your doctor if you have any medical conditions. But things that you can do to decrease your systemic inflammation. Vitamin D, and I'll also add in magnesium with that. So vitamin D is very key in reducing inflammation in your body. I'm not going to talk specifically about the physiology. And the reason why I mentioned magnesium with it is that oftentimes to create vitamin D, to process it, your body needs magnesium. Magnesium also has the benefit of being a muscle relaxer. So if you're taking magnesium, then you actually will have a relaxation of your muscles, in addition to the fact that it'll help you process vitamin D, which can decrease systemic inflammation. So again, getting those levels assessed by your physician and seeing if you're deficient and possibly adding those onto your diet is one thing. Certainly other things that you can look at Omega-3 fatty acids. These are things that are found in salmon, walnuts, other foods that oftentimes are deficient in people's diets. And oftentimes they provide an anti-inflammatory effect via a lot of research that has looked at that. So supplementing with pills, I tend to refer to a brand called Nordic Naturals, which I use frequently, which has good quality, and oftentimes supplementing with that can help bring inflammation down. Other things you can try, there are arnica-based rubs, or arnica, which is a kind of a natural herbal supplement that actually does have some anti-inflammatory properties. CBD is a newer thing, and for some people will say it's anti-inflammatory. It definitely has some pain-reducing effects. In some cases, if you take it orally, there are people who say it brings down anxiety, but it can have an anti-inflammatory effect for some, so that's another thing. And so there's also, and the last thing is, oftentimes I have patients just take a tablespoon of concentrated cherry juice. Just one thing to know about that, it's also a slight blood thinner. So if anybody is on blood thinning medications, again, any of these, if you have any medical conditions, you can be consulting with your doctor. But that's another way, just taking a tablespoon twice a day, usually just mixing it with water, that oftentimes will help bring some of that chronic systemic inflammation down. So these are ways that you can use to help increase your recovery from workout, but also to help you generally recover from injury, because oftentimes one of the things slowing you down with injury is the fact that you can't clear that inflammation. Or if you just generally feel achy, stiff, kind of crummy, it's important to think about these different things, to think about your diet, some of the supplementation, and also are you doing other things like maybe icing after a workout if you need to, or doing things like compression or foam rolling release work, things that may help you with your recovery and inflammation as you try to improve your function. That's it for this month. Join us next month on our Connected Functional Manual Therapy video blog.